Piles, also known as hemorrhoids, are swollen veins in the lower rectum or anus. This common condition affects millions of people worldwide, and though it may be uncomfortable or embarrassing to talk about, it's important to understand that piles are a medical issue that can be treated effectively with lifestyle changes, home remedies, and in some cases, medical procedures. In this video, we'll explore everything you need to know about piles, including what causes them, what symptoms to watch out for, how to treat them naturally, and tips to prevent them from coming back. Let's begin by understanding what piles are. Hemorrhoids occur when the veins around the anus or inside the rectum become swollen or inflamed. There are two main types of piles, internal and external. Internal piles form inside the rectum and are usually painless, but they may cause bleeding during bowel movements. External piles develop around the anus and can be itchy, painful, and sometimes even bleed. In some cases, blood clots can form in external piles, leading to a painful condition called a thrombosed hemorrhoid. Let's get more specific. Internal piles are graded based on severity. Grade 1, small swellings, no prolapse. Grade 2, prolapse during straining but retracts on its own. Grade 3, prolapse requires manual pushing back. Grade 4, permanently prolapsed, cannot be pushed back in. Now let's look at the common causes. One of the leading causes of piles is chronic constipation. When you strain too hard during bowel movements or sit on the toilet for too long, you put pressure on the veins in the rectal area, which can cause them to swell. A low-fiber diet that lacks fruits, vegetables, and whole grains is also a major contributor. Without enough fiber, stools become hard and difficult to pass, leading to straining. Other causes include prolonged sitting, lack of physical activity, obesity, pregnancy, and aging. During pregnancy, for example, the increased pressure on the pelvis and hormonal changes can make hemorrhoids more likely. Similarly, as we age, the tissues that support the veins in our rectum and anus can weaken, increasing the risk of developing piles. Symptoms of piles vary depending on the type and severity. The most common symptom is bleeding during bowel movements, often bright red blood seen on toilet paper or in the toilet bowl. Other symptoms include itching or irritation in the anal region, pain or discomfort, swelling around the anus, and in severe cases, a lump near the anus, which may be sensitive or painful. If you experience any of these symptoms, it's important not to ignore them. While piles are usually not dangerous, in rare cases, rectal bleeding can be a sign of more serious conditions like colorectal cancer, so it's always wise to consult a healthcare provider if the bleeding persists or if you notice a change in your bowel habits. So how are piles diagnosed? In most cases, a physical examination is enough. Your doctor may perform a digital rectal exam or use a small tool called an anoscope to look inside the anal canal. In cases of internal hemorrhoids, a sigmoidoscopy or colonoscopy may be recommended to rule out other conditions, especially if you're over 50 or have a family history of colon cancer. Now let's talk about the natural and home remedies to treat piles. One of the most effective ways to ease the discomfort is to make dietary changes. Increasing your fiber intake can soften stools and make them easier to pass, reducing the strain during bowel movements. Foods like oats, flax seeds, apples, carrots, lentils, and leafy greens are excellent sources of fiber. Along with fiber, drinking plenty of water, at least 8 to 10 glasses a day, is essential to prevent constipation. Avoiding spicy foods, fried items, and processed foods can also help reduce irritation. Another simple and soothing remedy is the sitz bath. This involves sitting in warm water for 15 to 20 minutes, 2 to 3 times a day, especially after bowel movements. It helps reduce swelling, improve blood flow, and relieve pain or itching. You can add Epsom salt or neem leaves to the water for added relief. Applying cold compresses or ice packs to the anal area can also reduce swelling and numb the pain temporarily. Do this for about 15 minutes at a time, several times a day. Just make sure to wrap the ice in a cloth. Never apply it directly to the skin. Aloe vera is another natural remedy with anti-inflammatory and healing properties. You can apply pure aloe vera gel to the affected area to soothe burning, itching, and swelling. Similarly, witch hazel, a natural astringent, can be dabbed on with a cotton pad to relieve pain and reduce inflammation. There are also over-the-counter creams and ointments that contain hydrocortisone or lidocaine, which can relieve itching and discomfort. However, these should not be used for more than a week at a time, as they may cause skin thinning with prolonged use. One of the most important steps in treating and preventing piles is to develop good bowel habits. Try to go to the toilet as soon as you feel the urge. Delaying it can cause the stool to become hard and dry. Don't strain or sit on the toilet for long periods. Also, using a footstool to elevate your feet while sitting on the toilet can help change the angle of your rectum and make bowel movements easier. Exercise is also very important. Regular physical activity such as walking, swimming, or yoga helps stimulate bowel function and improve circulation. It also aids in weight loss, which can reduce pressure on the veins in your lower body. Some herbs are traditionally used in natural medicine to support digestive and vascular health. Psyllium husk, a natural fiber supplement, is also beneficial in softening stools. Horse chestnut extract and butcher's broom are known to strengthen blood vessels and may be helpful in chronic cases, but always consult a healthcare professional before starting any supplement. In severe or persistent cases where home remedies don't work, medical treatments may be necessary. Preventing piles is all about maintaining a healthy lifestyle and avoiding constipation. Make fiber and hydration a daily priority. Stay physically active, avoid prolonged sitting, especially on hard surfaces, and practice good hygiene. After every bowel movement, gently clean the area with water or unscented wipes. Avoid harsh soaps or excessive scrubbing. In conclusion, piles may be uncomfortable and painful, but they're not something you have to live with forever. With the right care, lifestyle changes, and natural remedies, most people can find lasting relief. If you're experiencing ongoing symptoms or bleeding, don't hesitate to consult a doctor. Early treatment is always more effective than waiting. By taking small steps each day, eating healthier, moving more, and listening to your body, you can manage piles naturally and improve your overall digestive health.